Hey, welcome back. This is Dr. Wilder, and Happy New Year from Lifescape. We are here on the second anniversary of the very first COVID case reported in the United States. Actually, I think the very first one, or one of the very first, was here in Arizona. This also happens to be what would be my mom's 101st birthday. So given that she, who was a depression survivor, and depression went through pretty much her entire young childhood, teenage years, and she's a survivor of World War II. My dad was a veteran of World War II. She's the epitome of resilience, and resilience should be our absolute focus for moving on from this really rough couple of years. We have a lot of good news, I want to say, in terms of where we are in terms of COVID. The prevailing strain, this Omicron strain, although exceptionally infectious, it is about a third less lethal than prior strains, and will go a long way towards working us closer to more immune resilience in the 20 million Americans who are not vaccinated or protected in any way from this virus. We also have incredibly good news recently in a number of very large studies on the effectiveness of vaccines. It appears they have prevented more than nearly 250,000 deaths, 240,000 deaths, and 1.2 million hospitalizations have been averted in the United States because of extremely brilliant vaccines that are highly effective, and they are still our number one best preventive strategy against severe and COVID death. And we recently celebrated the very sad anniversary of a couple of our patients who we all adored, who passed away from COVID in early 2021. And so we grieve with those families, we grieve for those families, and so many of you who have lost loved ones, who've lost friends, even parents, over 840,000 Americans, which is just a mind-boggling number of people who've lost their lives to this. We also know from recent studies, if you are between the ages of 40 and 65, so kind of our moderate risk age groups, you are 44 times less likely to be hospitalized with severe COVID if you are fully vaccinated versus not vaccinated. The risk of this disease far outweighs the risk of vaccination. And the vast majority of deaths since the spring of 2021 are in unvaccinated patients. And to every healthcare worker, every unnecessary death is just heartbreaking to us and a sense of personal failure, to be honest. Now, if you are fully vaccinated and boosted, you are 90% less likely to be hospitalized with COVID, with Omicron. Now, that drops to 30% if you are vaccinated but have not yet been boosted. Those, though, who are immune compromised or who have a number of multiple risk factors or are extremely frail are always going to be at risk for COVID and for influenza and for any infectious disease that happens to be circulating. So we do understand that. Right now, of the vaccinated patients who end up hospitalized with COVID and fully boosted as well, 8 out of 10 have more than 4 chronic health conditions, 4 comorbidities that put them at high risk, or they're severely immune compromised, which we all know cancer patients, people on chemotherapy, people who are on immune suppressing drugs for autoimmune conditions and arthritises, etc. So we still have to be thoughtful of those very high-risk people in our community. Some critical takeaways on COVID, just to update. no matter how careful we are, we will eventually all catch this bug. It is not a matter of vaccine risk versus no vaccine risk. It's a matter of vaccine risk versus your risk of getting natural COVID. And JAMA recently reported the risk of COVID infection far outweigh the risk of vaccination. It is a no contest at every age. The risk of myocarditis in young adults, far higher with natural COVID infection than with vaccination. So really, if you're still on the fence or worried about vaccination, please speak to your provider about where the risks and benefits lie for you individually. It is an individual decision. So, but have those healthy discussions. Don't let social media be your only research, because it's not the ideal place to be getting our medical information. Like influenza, Omicron can be missed by testing in the very earliest stage of infectiousness. So it can be infectious for a couple days before you can pick it up on a nasal swab. And we do have some good data showing that swabbing the throat and the nose, when we do those rapid tests in particular, improve the yield for catching Omicron, but the FDA doesn't advise that for home testing because of the risks of hurting yourself doing a throat swab if you're not a health professional. If you do test positive, don't keep retesting to try to get a negative test. I see this again and again. Maybe I'll take the best of three. I tested positive recently when I tested my whole staff after the Christmas holidays, and we'd had a slew of cases in the previous week. My test ended up being a false positive, but I did my due diligence and weighed on the side of safety, and I isolated from my own family who were here visiting, etc., because we're always going to lean on the side of safety. So isolate as directly, ideally for that infectious period. If you are symptomatic, even if you test negative, please isolate or stay home or really strictly mask and be very, very careful, because there are many, many false negative tests, far more false negatives than false positives with all of these tests. And those are the biggest mistakes I see people making, is wanting to break out of isolation early. And believe me, having now new empathy for going through isolation, I totally understand it. It is not an easy thing to do, but it is the best thing we can do to take care of each other. Now, as this becomes endemic, and meaning it's going to be around with us for a very long time, there will be new strains. There will be recommendations for boosters that evolve over time. We need to understand science is not a black and white certainty thing. It is an evolving and ongoing learning process. Now, we are always questioning. We are always asking, well, what if? What if we do this differently? So that's a good thing. That's what we want. Today's dogma is tomorrow's dog. You know what? So don't expect that because somebody changed their recommendations that's a bad thing. I mean, that's intelligent. Somebody who's sticking to the same dogma day upon day upon day, despite data that's going against that, that's not the person that you want to be following. I guarantee it. But as more people develop some immunity, and we develop better treatments, which right now we really struggle because the treatments are not widely available. It is very hard to get monoclonal antibodies that work for patients against the Omicron variant. It is very hard to get Paxlovid. I spent 40 minutes on hold with one of 2 pharmacies in the city that had some available that evening for a patient. So please hunker down for the next couple weeks. Be very, very careful, because we're still in a situation where there are some great promising treatments, but they're not widely available. So we want to be thoughtful and cautious about that. Let's see, how do I get, you know, this is likely to become largely like influenza, I think, over time. Maybe not with quite the same seasonality, because we do see summer surges with Omicron as well as winter surges. But just like influenza, those who are at highest risk, which again are the elderly, the older you are, 40 to 50 and up, very frail, or if you have chronic medical conditions, or pregnancy, which is still a significant risk factor for severe COVID, we're going to have to be careful. You're going to have to maybe consider masking when surges are happening, avoiding crowds, avoiding situations where exposure risk is high, and those of us who are in close contact with those high risk factors have to be equally careful, because you're only as safe as your inner circle of people that you're in close contact with. And we, again, strongly encourage our number one defense against severe illness is being great stewards of our own health. And that means eating healthy, getting healthy sleep, exercising regularly, maintaining a healthy weight, and working with us diligently to reverse all the chronic health conditions that are reversible that put people at higher risk. That's weight problems, blood sugar problems, high blood pressure problems, vascular disease. These are all, if I can do anything, it's to empower people to understand chronic disease does not need to be a life sentence. You have the power to unlock the shackles of a lot of that chronic disease. And, it's those simple, basic things. Don't ever smoke. Keep alcohol on a minimum. Sleep healthy, eat healthy, exercise. Those 4 or 5 pillars that we talk about all the time can reverse 75% of the chronic disease in the United States right now. And that includes mood disorders and cognitive disorders as well. So that's my quick COVID update. On the realm of chronic disease, I want to talk a little bit about my most recent article in our concierge newsletter, which is on the importance of plant-based eating. Almost every result that I send back towards patients includes the guidance of shift a little bit more plant-based, eat more plant-based, 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 plant-based. So we say it so often, I practically say it in my sleep. My kids are sick of it, my husband's sick of it, but why the push, and what does it mean? Does that mean I have to be a vegetarian? Does it have to be vegan? What exactly does plant-based mean? And it basically means that the majority of what we eat, so I'm aiming for a minimum of 50%, but ideally 75 to 80% of what we eat comes from a plant, grows in the ground, not made in a plant, but grows from a plant. So fruits, vegetables, whole grains, the legumes, things like that. You don't have to be vegan or vegetarian, but keep animal proteins as more of a condiment or more of a side, and look at 50 to 75% of your plate should be colorful fruits and vegetables, and maybe some whole grains or starchy vegetables as well. So the protein is palm of your hand. When you go out to a restaurant, how often is that the portion of protein that you're served, right? It is usually about 3 or 4 hands worth, and so we just need to dial that down a little bit. Perfection is not the goal. Nobody can live forever in a state of deprivation. That's not the goal we're going for. As my daughter used to say when she was little, I'm a little bit bad and I'm about the middle of good. and that's about what we're going for with diet as well, and kind of getting out of that good bad mindset is also pretty important, because we just want to learn habits that start to make this easy, and just kind of mindless, because most of how we eat is not thoughtful and mindful. It tends to be mindless, and kind of habitual, right? We kind of get into habits. In fact, my husband and I were in pretty much every winter get into the nightly Costco pumpkin pie habit, and then did our lab work after the holidays, which, most people want to train for their lab work and have their lab work done at that when their diet's absolutely the best it can be. I would rather see the worst case scenario. I can help people with the truth. I cannot help people with fiction, right? And so we do these lab tests to kind of help us understand, okay, what's the worst case look like? And, so we looked at each other and said, Houston, we got a problem. We got to reel this in a little bit and make those little changes, which, included getting off the Costco pumpkin pie. And maybe I can make my own low sugar, much healthier version of something similar, a similar treat that we can enjoy just as much without the things that are not loving us back. Let's put it that way. And remember, being vegan or extremely, plant-based, there are some challenges with those diets too, and those have to be, really undertaken with a lot of care and a lot of mindfulness towards getting the right nutrients you need, whether they be B vitamins, calcium, vitamin D, enough iron, enough protein. I've been playing with an app off and on over the past year when I struggle with carbs. I actually genetically am want more sugar in my diet, and that's just one of the things I've had to learn to deal with. So I'll use an app called Carb Manager that allows me to actually, put in every single thing I'm eating over a several day period and see how much protein am I getting, how many carbs, how much fat, how many calories am I tending to consume overall. And I find I struggle the most getting enough protein, and I am not vegetarian, but just even with the amount of meat, fish, chicken, and some dairy that I might be consuming, I was really struggling to get enough protein. So I have to be more mindful of sometimes adding some proteins with maybe an added protein boost to my smoothies, or adding a little collagen to my coffee, or occasionally my snacks in the office in the afternoon might include a protein, a whole food protein bar. And we know all of the healthiest diets have in common some basic things. I am a moderate in everything. As a biologist, we know the most healthy systems are diverse, have a tremendous amount of diversity. Same is true with the human body. The more diverse our diet, the healthier we tend to be. But we're creatures of habit, right? So we tend to eat the same thing. I like my same breakfast every morning, or I like my same lunch every day. As I tease with my husband sometimes, I'm going for rainforest here, but sometimes we're Sahara Desert, So that might be having 4 or 5 different breakfasts to choose from and rotate, or rotating different milks on a regular basis. I tend towards plant-based milks, like flax milk or coconut milk or almond milk, that kind of thing. But all the healthiest diets that are proven to improve all kinds of health outcomes include more fruits, more vegetables, nuts, seeds, beans, and whole grains. That's across the board. They are very diverse. So you want to, there's some great phytonutrient spectrum handouts, but aiming for every color every day of the rainbow. So some purple foods, some red foods, some orange foods, some yellow foods, and definitely dark leafy greens on a regular basis. Every healthiest diet avoids refined and processed foods, which is over 60% of the American dietary intake, probably closer to 80% for most of our young kids. And you wonder why depression, anxiety, obesity, diabetes, etc., are skyrocketing, and colon cancers happening decades earlier than it used to. It is that intake of highly refined and processed foods. Think of pretty much most of the bakery aisle, most of the cereal aisle. And then again, every healthy diet avoids added sugars, which right now the average American is consuming 3 to 4 times as much added sugar in a day as is recommended. And avoiding sweetened beverages and saturated fats, and I would add processed meats to that. So sausage, things I love, sausages and bacon and things like that should be a real minimum. Those are absolute, we call them frankenfoods in the nutrition field. So what are the benefits of going plant-based? Very rapidly, people's immune system gets boosted. If you are on a healthy diet before you get a vaccine, such as COVID or flu or whatnot, your immune reaction, your antibody response is going to be substantially higher. If you get that vaccine when your blood sugar is very high, or you already have a lot of inflammation going on because you had a Big Mac 3 days before or ate some kind of other splurge meal, your immune response is not going to be that great. So even within days, you can see a change in immune response. It affects the health of your gut microbiome, which, as we've talked about before, is the heart of your clearing toxins, your hormone health, your immune function. These trillions of microbes need healthy phytonutrients, plant-based nutrients, and fiber to thrive. You'll see improved mood and sleep within a week or so. You will see reduced inflammation, profound. It is amazing when we get people off of the refined and processed foods, and sometimes dairy as well. A lot of inflammatory problems go away. For me, getting off of gluten was like the Tin Man got oiled. I did not feel 100 every morning. I don't have any arthritis. Arthritis, aches and pains, some people think those are normal as we get older. They are not normal. You do not have to have them. Work with Dana, and I can guarantee she can help you find a diet that works to get rid of that. You'll see improved hormone production and balance. No one should go on exogenous hormones without first attending to diet, sleep, and alcohol use. I guarantee when you fix those 3 things, a lot of hormone problems fix themselves. You'll see better satiety. If you're somebody other than me, you might see weight loss. I'm not seeing weight loss, but and you'll see reduced all-cause mortality. The American Journal of American Heart Association study showed all-cause mortality drops 25% with a plant-based diet, and 30% with a healthy plant-based diet. There are unhealthy vegans out there where you're avoiding refined and processed foods again. And then a reduced risk of a ton of health problems. Blood pressure gets better. You can have 30% lower risk of hypertension just shifting plant-based. 31% reduced risk of dying of heart disease shifting plant-based. And I've got some great patients out there who are absolute role models of this. Nobody should have a heart attack or stroke before the very end of life. Obesity and type 2 diabetes substantially lower in vegetarians and vegans. Many cancers are improved by plant-based diet, especially colon, breast, prostate, lung, and uterine cancer. And then cognitive impairment, dementia. If I had a drug that could reduce your dementia risk 40 to 50%, would you take that drug? Well, that drug is fruits and vegetables, is eating more plant-based. This is recent study, Frontiers of Aging in Neuroscience, found that for every half a cup of fruit and vegetable intake daily, reduced your cognitive impairment dementia risk 13%, just a half a cup. So go out there, eat more plant-based, work with Dana if it's a struggle for you and you're figuring out how to change that up. Work on the 5 S's that I learned at the Harvard Culinary Institute culinary medicine course that Dana and I are about to go to again in a couple weeks. 5 S's to get more fruits and veggies, of course salads, smoothies. I love adding some greens to smoothies or starting with a green drink like my favorite Suja or organic mighty greens. Soups, stews and chilies, stir fries, and I'd say sauces too. So Dana's Healthy Kitchens class is a great way to learn some options. There's tons of good plant-based cookbooks out there now, and we'll keep sharing resources with us as they come along. If I have time, let me see. I've got just a couple minutes. I'm going to see if I can tell any questions here, which I cannot see them. So I will have to answer questions afterwards. I will get back to you on the online forum. But that's it for now. Stay healthy, stay happy, have a happy, healthy new year, and let's let 2022 be the year of resilience and stewardship of our health. Enjoy. Take care.